Hey everyone, welcome back. And today we're going to focus on how a rational-emotive behavior therapist, REBT, might treat ADHD, attention deficit hyperactivity disorder. So rational emotive behavior therapy can be a valuable approach for treating individuals with ADHD, particularly in addressing the secondary emotional disturbances and irrational beliefs that often accompany the disorder. While REBT doesn't directly cure the core neurological symptoms of ADHD, like inattention or hyperactivity, it provides a framework to help individuals cope with the challenges, manage their reactions, and improve their overall well-being. Here's how an REBT therapist might approach treating ADHD. Identifying and disputing irrational beliefs, the ABC model. The core of REBT is the ABC model. A is the activating event, or an adversity. An event or situation occurs, forgetting an appointment, struggling to focus on a task, receiving criticism. The B is the beliefs. The individual holds irrational beliefs about the activating event or adversity. For example, I'm a complete failure because I forgot that. I'll never be able to finish anything. It's awful and I can't stand it when things are difficult. And then C, the consequence, the emotional or behavioral or physiological consequence. These irrational beliefs lead to unhealthy emotional and behavioral consequences, for example, intense anxiety, frustration, anger, self-criticism, avoidance, and procrastination. An REBT therapist would help the individual identify their specific irrational beliefs related to their ADHD symptoms and the challenges they face. These often include demandingness, rigid demands on themselves or others. I must be perfect. They should understand my struggles. Catastrophizing, exaggerating the negative consequences of an event. This is the end of the world. It's absolutely terrible. Low frustration tolerance, the belief that they can't stand discomfort or difficulty. I can't tolerate this boredom. It's too hard. I give up. Or self and other downing, globally rating themselves or others negatively based on specific behaviors. I'm useless. They're so inconsiderate. The therapist would then actively dispute these irrational beliefs using logical, empirical, and pragmatic arguments. This involves asking questions like, where is the evidence that you must be perfect? Is it truly the end of the world or just a significant inconvenience? Even if it's difficult, can you actually stand it? Does forgetting one thing make you a completely useless person? Cultivating rational alternatives and effective behaviors. After disputing irrational beliefs, the goal is to help the individual develop effective new philosophies that lead to healthier emotions and more productive behaviors. This involves acceptance, helping individuals accept their ADHD diagnosis and its inherent challenges without resorting to self-downing. This means accepting that they have ADHD, but not that they are their ADHD. Unconditional self-acceptance, encouraging individuals to accept themselves as flawed human beings who make mistakes rather than judging their entire worth based on their ADHD symptoms or errors. High frustration tolerance, developing the belief that while challenges are uncomfortable, they are tolerable, and that enduring difficulty can lead to growth. Flexibility, replacing rigid demands with preferences and desires. And problem solving. Once emotional distress is reduced, the therapist can then help the individual develop practical strategies to manage ADHD symptoms. Addressing specific ADHD-related challenges through REBT principles. Emotional dysregulation. REBT directly targets the irrational beliefs that fuel intense emotions like anger, frustration, and anxiety, which are common in ADHD. By challenging catastrophic thinking or low frustration tolerance, individuals can learn to respond to triggers with less emotional intensity. Techniques might include rational self-talk, identifying and challenging the shoulds and musts that lead to emotional outbursts, and practicing self-compassion. Executive functioning difficulties, planning, organization, time management, procrastination. While REBT doesn't directly teach these skills, it can address the underlying irrational beliefs that hinder their development or implementation. For example, procrastination. Challenging beliefs like, it's too overwhelming, I can't start, I must do it perfectly. The therapist might encourage breaking tasks into smaller steps and focusing on good enough rather than perfection. Disorganization. Addressing beliefs that about needing to be perfectly organized or that a messy environment is catastrophic. This allows for more realistic and manageable organizational strategies. Motivation. Challenging beliefs that lead to discouragement or give up easily due to perceived failures, and instead focusing on progress and effort. Impulsivity. While impulsivity is a core ADHD symptom, REBT can help individuals develop pause and pivot strategies by identifying the irrational beliefs that might precede an impulsive action, such as, I need this now, I can't wait. Self-esteem. Many individuals with ADHD develop low self-esteem due to past struggles and criticisms. REBT promotes unconditional self-acceptance, helping them separate their worth as a person from their ADHD symptoms or past mistakes. Behavioral techniques and homework. REBT often incorporates behavioral techniques to reinforce rational thinking and new behaviors. This might include homework assignments, practicing disputing irrational beliefs in real-life situations, rational emotive imagery, mentally rehearsing healthy emotional and behavioral responses to challenging situations, exposure, gradually facing uncomfortable situations that might trigger irrational beliefs, starting a task, skill building. While not the primary focus, the therapist might also encourage the use of practical strategies for ADHD management, planners, reminders, routines, once the individual's emotional and cognitive blocks are addressed. In summary, an REBT therapist treating ADHD would focus on empowering individuals to identify and change their irrational beliefs about their condition and its challenges. By developing more rational and flexible ways of thinking, individuals can better manage their emotional responses, reduce self-defeating behaviors, and improve their ability to cope with and succeed despite their ADHD symptoms. It's often used in conjunction with other interventions such as medication and behavioral coaching for a more comprehensive approach. So what do you think? What do you think about how REBT would treat ADHD, and would that be a therapy that you think would be useful? Let me know your comments, and I'll speak to you next time.